A common pathological cause of high prolactin levels in the blood, leading to infertility, is a tumor in the pituitary gland. However, this is not always the only cause of high prolactin levels in the blood in infertile women. Some women have high prolactin levels in the blood, but no tumor in the pituitary gland. In the previous video, we saw that chronic stress can elevate prolactin levels by suppressing dopamine activity in the brain. Today, we will explore 4 other commonly overlooked causes of high prolactin levels in the blood in women without pituitary tumors who may have difficulty with regular ovulation, conception, or implantation. The cause number 1 could be the antidopaminergic gastrointestinal prokinetic agents, which are commonly used to treat nausea and vomiting. Presently, there are 3 such antidopaminergic antiemetic agents: domperidone, levosulpiride, and metoclopramide. These 3 drugs, commonly used to treat nausea and vomiting, are antagonists of D2 receptors, meaning these drugs could inhibit D2 receptors. Another drug called prochlorperazine that is used to treat nausea and vomiting also inhibits D2 receptor. So, what is the consequence of blocking D2 receptors on prolactin levels? As we discussed in the previous video, blocking D2 receptors inhibits the activity of dopamine. And inhibiting dopamine activity in turn impairs the control of prolactin production. However, this does not mean you should avoid taking medication for nausea and vomiting when it is necessary and prescribed by your doctor. There are other drugs available to treat nausea and vomiting which do not increase prolactin levels. Such drugs might be safer if you have a tendency toward high prolactin levels and are undergoing infertility treatment. So please discuss this with your doctor, and do not change your medication without consulting your doctor. Now, the cause number 2 could be the antacid and anti-ulcer drugs cimetidine and ranitidine. These drugs are used to reduce stomach acid production and relieve heartburn. Both of these drugs act as histamine H2 receptor antagonists. It means that these drugs blocks histamine from acting through the H2 receptors. The use of these drugs can raise prolactin levels and cause hyperprolactinemia through mechanisms that are not yet fully understood. Scientists hypothesize that H2 receptors play a positive role in dopamine production, and the inhibitory action of cimetidine and ranitidine on these receptors might reduce dopamine production. And as we discussed in previous videos, dopamine actually reduces or inhibits the production of prolactin. However, this always does not mean that you should not take pills to control acidity and heartburn when necessary and prescribed by your doctor. There are other drugs available to treat acidity and heartburn which do not increase prolactin levels. Such drugs might be safer if you have tendency for high prolactin levels and are undergoing infertility treatment. So, please discuss this with your doctor and do not change your medication without consulting your doctor. Now, the cause number 3 could be the chest wall irritation associated with herpes zoster virus infection. There are case reports suggesting that herpes zoster infection or shingles involving the breast and nipple parts could lead to elevated prolactin levels. This is because persistent irritation of the chest wall might increase prolactin levels due to the stimulation reflex. In such cases, treating herpes zoster or shingles effectively may help normalize prolactin levels. So if you have recent herpes zoster infection or shingles, please discuss with your doctor. Now, the cause number 4 could be the itchy, severe hypertrophic scars on the chest. There are case reports suggesting that itchy, severe hypertrophic scars on the chest, such as those resulting from burns, could lead to elevated prolactin levels. In such cases, treating these scars along with prolactin-lowering agents may help normalize prolactin levels. If you have itchy, severe hypertrophic scars on your chest, consult your doctor.